Well, I want to welcome you to this presentation on vitamin D. So now you need to take notes, so get something to write on, and let's get started. Being this far north of the equator, meaning above 37 degrees latitude, or for us, north of Tennessee, we do not get enough sunlight to be effective at producing vitamin D with sun exposure on our skin. Because of our location this far north, we are the most deficient area in the world for this vitamin. We must supplement with vitamin D3 to get enough for our bodies to function properly. Many say, well, Dr. Jerry, I spend a lot of time in the sun, so I don't need to take vitamin D. Well, that may be true if it's summertime and it's in the middle of the day and you're in a bikini, but in the spring and the fall and the winter months, we cannot get enough UVB rays from the sun to produce vitamin D in our skin. Another consideration is our skin color. Now, light-skinned people produce more vitamin D than dark-skinned people. The lighter your skin, the more vitamin D you might produce if you have the right sunlight. The darker your skin, the longer it takes for you to produce vitamin D in your skin. Overweight people need more vitamin D to get the therapeutic doses that they need. This vitamin is stored in our adipose or fat tissue, so it takes a lot more for an overweight person to get their vitamin D levels up sufficiently so that it can perform all the different functions in their body. Vitamin D is blocked by those of you who wear sunblock. Because if you're blocking the sun UVB rays to prevent burns, you're also blocking your ability to make vitamin D. So remember that when you're with your children and they're out playing and you put sunblock on them. They cannot get this needed vitamin for their bone strength and muscle health. Hello. I want to share with you some information about sun blockers later in this presentation. Another thought. Glass. If you sit in the window and you feel the warmth of the sun coming through and it really feels good, but you're not making any vitamin D because all forms of glass block the vitamin D producing rays of the sun. Tanning booths may have lights that deliver UVB rays and will aid in the vitamin D production in your body. Ask the clerk if their tanning lights put out UVB rays. Tanning booths can be a great source of UVB rays, especially when you're a person who needs vitamin D. And for those of us who want extra vitamin D in the spring and the fall and the winter time. Vitamin D blood testing is needed to know how much vitamin D you have. Vitamin D testing is also needed to determine how much vitamin D you need. And then, of course, to make sure that you don't get too much, although I can say this. Vitamin D2 is the only form of vitamin D that becomes toxic in the body. The vitamin D3 that we supplement from the health food store does not become toxic in the body. In the testing that I mentioned, the normal blood level for this vitamin is 35 nanograms per milliliter, but the optimal range is around 100 nanograms per milliliter. These are the numbers that you see in the blood or in the lab test that you get. So when you get the test back, it'll say numbers similar to that. There's a debate going on about what the optimal range actually is, and that's okay. I've seen many results, and in my classes I've learned that somewhere between 80 and 100 nanograms per milliliter of vitamin D is sufficient, and it's in the optimal range so that we know that your whole body is getting this vitamin to do the job that it's supposed to do. Vitamin A is needed along with vitamin D to function properly. They support each other. So vitamin A, 1,000 international units a day, will provide sufficient amounts of this vitamin to support the function of vitamin D. Vitamin K is also needed to form bone mass. 50 to 70 micrograms a day will work fine for your needs. Vitamin D is a pre-hormone, or some call it a prohormone. It is a vitamin and a hormone in its function in the body. A vitamin is defined as an organic compound needed for the metabolic process or reaction in the body. A hormone is defined as a chemical substance that regulates an activity and acts as a chemical messenger. As a vitamin, vitamin D is fat soluble, which means it's able to be stored by the body. Vitamin D promotes the body's absorption of calcium, which is essential for the normal development of healthy teeth and bones. It also helps to maintain adequate blood levels of the minerals calcium and phosphorus. In adults, it helps with any function that utilizes calcium or phosphorus, such as the transmission of nerves, the beating of the heart, blood clotting, and many others. Insufficient vitamin D prevents the ionization of calcium and thus makes the calcium less able to play its role in the functions of the body. This leads to cell energy starvation, causing fatigue, headaches, muscle cramps, allergies, and gut problems, and a lot of other problems. Over time, this becomes serious. You may have hypertension or asthma, osteoporosis, arthritis, etc. As a hormone, vitamin D cannot be made directly from cholesterol like other hormones. It needs vitamin D from sunlight exposure or supplementation to exist in your body. Most organs and tissues in the body can activate vitamin D when there's enough to meet their own needs. Simply put, the more vitamin D you take in, the more vitamin D you have in your blood, the more vitamin D you have in your brain and body. The only things that limit the amount of vitamin D you have is your lifestyle. Research shows that vitamin D helps cancer patients as it regulates cell growth to prevent mutations or cancers in the breast, tissue, colon, lungs, prostate, etc. It regulates immune function to aid in the prevention of MS, rheumatoid arthritis, diabetes, and other autoimmune diseases. It participates in the regulation of blood pressure. It regulates thyroid hormone production. It helps to regulate insulin hormone production. Vitamin D enhances your mood. It plays a role in bone absorption of calcium along with vitamin K. Supplementing with this vitamin is needed to increase your vitamin D levels. Did you know that it takes 40,000 international units of vitamin D to raise your blood level of this vitamin by 1 point? So, if your blood levels are at 49 nanograms per milliliter, and you need to be at 80 nanograms per milliliter to reach the optimal levels, you need to make up the difference. Since it takes 40,000 international units to raise your blood levels by 1 point, it's going to take a lot of vitamin D3 to get the optimal range you need to prevent diseases. So, that's 31 points that you need to make up just to get into the optimal range. That translates into 40,000 times 31, or 1,240,000 international units of vitamin D that you need to supplement. Of course, you're not going to take that much all at once, but you will need to take 40,000 units a day for 31 days or more just to increase your levels. But then there are other things to consider as you supplement. I mean, after all, your body uses this vitamin all the time. And when you use this vitamin every day, things like stress and illness and calcium needs of the body and many other factors play a role in how much vitamin D you use up every day. We don't just store it, we use it up. And so, how much of this vitamin do you have available for daily function? Only testing can reveal that answer. When a vitamin is used in different actions of the body, it's gone. It's used up. When you need more, you have to replace it. You have to supplement. So, What type of vitamin D do I want to take? Vitamin D comes in two forms, D2 and D3. The D2 part of this vitamin, or version of this vitamin, is a synthetic form. It's really not good for your body. It's only stored in the body. It's called ergocalciferol, and there are other prescription names for it because you get these from a medical healthcare practitioner. It is not the useful or active form of this vitamin. It stores in your adipose or fat tissue. It can reach toxic levels if too much is taken. Of course, it takes a lot to do that, over 150,000 units or more, before it can become toxic in your body, but it can become toxic. Vitamin D3 is the other form of the vitamin. It's the active form. It's the kind of vitamin D that your body actually uses. It cannot build up and become toxic in your body because you use it up every day. It's called cholecalciferol. The active form of this vitamin is used in every part of your body. Cholecalciferol is the supplemental D3 that you see in the stores. It comes in dosages ranging from 400 international units to 10,000 international units. And when you're deficient, you need to bring levels up to optimal ranges to receive the full benefits of this vitamin. Taking 40,000 units a day is not uncommon as you work to increase your vitamin D levels. You can do this amount for months and months and still see little change in your blood levels of vitamin D3. Remember, you're using it almost as fast as you take it in. So D3 stays in the body for only a few hours. Taking 2 or 3 doses a day will help keep your levels elevated for use throughout the day. Also remember that if you are sick or have been under lots of stress, the amount of vitamin D you need increases significantly. What you do take may not even reach your storage sites in your adipose tissue. Once in your body, vitamin D3 travels to the liver and is metabolized into calcidiol. It's what your body does. It takes D3 from the supplement and turns it into this calcidiol. And that's what they test for in your blood. Calcidiol travels first to the kidneys, and then if there is any left over, it travels to the cells of your body. In the kidneys, calcidiol is converted to calcitriol. This is the steroid that turns your genes off and on. It is the calcidiol and calcitriol that is referred to when we talk about vitamin D and what it does in the body. Calcitriol helps maintain blood calcium levels. It is the most potent steroid hormone in the body. If blood levels of calcidiol fall below 40 nanograms per milliliter, you may develop any number of chronic inflammatory diseases. Many hormone functions will simply not happen because they need vitamin D in the calcidiol and calcitriol form to complete their assignments. If calcidiol isn't used up in the kidneys, it will, thankfully, make its way to the tissues of your body. The only way to have enough is to supplement with large doses of vitamin D3. It goes to the skin and the muscles and all other cells of your body. In your cells, calcidiol is turned into calcitriol just as it is in the kidneys. The more calcitriol made in your cells, the more certain genes can be turned on to fight cancer and other diseases. Research shows that calcitriol activates more than 2,000 different genes, and the research is ongoing, so they're finding new genes on a regular basis that calcitriol activates to protect your body. Some genes will either make proteins essential to fight cancer, or other genes, in the absence of calcitriol, will be activated to produce cancer and disease. Summary of what I just said. D3 supplement is converted by the liver to make calcidiol that is used first by the kidneys to regulate blood calcium levels. Very important. It gets used by the kidneys first. The parathyroid glands, which are right here, and there's 4 of them, they sense the levels of calcium in your blood. And depending on how much calcium there is, they may send out a parathyroid hormone that your kidneys use to draw back calcium from the fluids that are going to be excreted to increase your calcium level. If the parathyroid hormone levels drop, the kidneys will allow more calcium to flow from the body in the urine. The more parathyroid hormone in the blood, the more calcium there is right along with it. So the less parathyroid hormone, the less calcium. The kidneys also put out calcitriol, which turns on the digestive tract calcium pumps so that it can receive the calcium in your food. So if vitamin D levels drop, parathyroid levels increase to pull calcium from the urine before it's excreted. If vitamin D levels reach optimal levels, then the parathyroid hormone levels drop, and calcium is taken from your food instead of from your bones. That is how bones become weak and brittle. Supplementing with calcium does little good if you do not have sufficient amounts of vitamin D to activate all of the processes to receive it into your body. Did you get that? It doesn't matter how much calcium you take if you don't have enough vitamin D3 supplemented so that you can turn off the parathyroid hormone and allow the body to use the calcium from your food and from your supplements. Another thought. High calcium intake from supplement and low vitamin D intake below optimal levels, you develop osteoporosis and many other autoimmune diseases. Bone is composed of osteons. These little compartments that are constantly being formed and dissolved on the influence of the parathyroid hormone. Your bone strength depends on you having enough vitamin D to keep your parathyroid hormone levels low so that your osteons are not dissolved. Remember that high levels of vitamin D is needed to get calcium from your food or supplements. The 400 IU amounts of vitamin D in your supplement is not sufficient to keep the balance of parathyroid hormone and vitamin D that you need to build bone mass. Just a side note here. Your parathyroid levels can drop in a matter of minutes when you have enough vitamin D. So that's real simple to reverse that damage process. High parathyroid hormone, bone loss. Low parathyroid hormone, high level of vitamin D, building bones. If you don't meet those two needs, you won't build bones no matter how much exercise or how much calcium you take in. The transition of high parathyroid hormone to low parathyroid hormone acts in a matter of minutes. But to begin to activate the calcium pumps in your digestive tract so that you can receive calcium from your food takes a while longer. So taking magnesium is needed to remove calcium that has built up in your joints from the hypercalcemia or excessive calcium that you may have had with high levels of parathyroid hormone. And so you get the magnesium, 500 to 1500 milligrams a day. As you begin getting calcium from your food and you receive this amount of magnesium, then it will remove the calcium buildup that you have in your arteries and on your joints and places. If you have enough vitamin D3, then there will be sufficient calcidiol to go beyond the kidneys. The less vitamin D you take in, the less fight your body is going to be able to make to prevent or reverse disease. Patients with blood levels of calcidiol with levels below 37 nanograms per milliliter, they show signs of depression. With blood levels above 46 nanograms per milliliter, their symptoms of depression disappear. I've been there. My levels are higher now than they were a year or so ago. And so now I'm feeling good, perking up, ready to go and enjoy each day. So vitamin D helps prevent eye problems, conjunctivitis, myopia, cataracts, and a lot of other diseases. We'll go through some of those later. Some foods like egg yolk, fish, seaweed, shiitake mushrooms, some dairy products do have fortified vitamin D2 in them, but it's not sufficient to meet your body needs. And again, it's in a storage form. So here are some of the symptoms you may experience when you're deficient in this vitamin. Muscle pain, weak bones or bone loss, especially if you're taking diuretics, and are low in other fat-soluble vitamins like vitamins A and K. Low energy levels, you'll experience that. Fatigue, poor immunity leading to frequent colds, allergies, and autoimmune diseases. I've already mentioned depression, irregular sleep patterns. By having sufficient amounts of vitamin D3, cholecalciferol, your cells can take up the properties they need to fight diseases like heart disease, hypertension. You see, vitamin D helps regulate blood pressure, arthritis, chronic muscle pain, irritable bowel syndrome, obesity, PMS, muscular weakness, osteoporosis. Vitamin D slows the aging process. It improves neuromuscular function. It helps fight against cirrhosis of the liver. It assists in the treatment of cancers. Remember, vitamin D, as calcidiol, gets down into the cells of your body and it activates the genes that stop the damage processes. Fibromyalgia is another of the problems. Diabetes, skin diseases like psoriasis and eczema, celiac disease. It's a disease of the digestive tract where people are not able to tolerate gluten from wheat and grains. Excess calcium levels in the blood or hypercalcemia. And of course you understand that because of the parathyroid hormone. If you're low in vitamin D, you're going to be high in this parathyroid hormone, which is pulling calcium from your bones. And so if you have hypercalcemia, know that you're developing weak bones because your calcium sources are coming from your bone loss, not from your diet or supplements. Magnesium is needed to dissolve calcium deposits and neutralize the calcifications. It takes optimal levels of vitamin D to stop the parathyroids from releasing so much hormone that causes bone loss. Calcidiol is needed to absorb calcium from your food. Calcidiol is needed to build bone matrix. Along with vitamin K, vitamin D will assist in calcium absorption or resorption back into the bone matrix when there's sufficient amount of calcium coming from the diet or supplements. 1,200 milligrams of calcium citrate every day will give you what you need to use in the process of rebuilding your bones, provided you have enough vitamin D to accomplish that. Some say that those taking diuretics with thiazides should not take vitamin D. However, there is no evidence to suggest that people taking diuretics have any particular different requirements for vitamin D. The reduction in urinary calcium loss resulting from treatment with thiazide diuretics is due primarily to the changes in kidney function and may also, in part, to changes in vitamin D metabolism. On the screen, you're seeing levels of vitamin D from the blood testing that you would have done. This shows the numbers that you would see and what they mean. Remember that it is only the vitamin D2 that can build up to toxic levels in your body. And you do not get vitamin D2 except by prescription from your medical practitioner. Vitamin D is referred to in many ways, and I'm showing you those now so that you can see why I did not use all those abbreviations in this presentation. The writers of many labs use these terms interchangeably, and it creates much confusion when you read their report. UV radiation, or ultraviolet radiation, is part of the electromagnetic light spectrum that reaches the Earth from the Sun. It has light wavelengths shorter than visible light, making it invisible to us. We can't see it. These wavelengths are classified as ultraviolet A and ultraviolet B, and there is an ultraviolet C, but that's not part of this discussion. Both UVA and UVB light penetrate the atmosphere and play an important role in conditions such as skin wrinkles, aging, eye damage including cataracts, and skin cancers. These ultraviolet rays also suppress our immune system, reducing our ability to fight off these diseases. UVA rays make up 95% of the ultraviolet radiation reaching the Earth's surface. UVA rays are present with relatively equal intensity during all daylight hours all year long and can penetrate clouds and glass. UVB rays are only present in sufficient amounts during the summer months for those of us this far north of the equator, or 37 degrees latitude, which is anything north of Tennessee. UVB rays are needed to produce the vitamin D that we need to fight diseases in our body. UVB rays cause sunburn and can worsen skin cancers with overexposure. Did you know that your skin actually tans because damage to the DNA in your skin cells from UV exposure causes the skin pigment to darken as the body attempts to prevent further damage? UVA rays penetrate the skin more deeply than UVB rays. The sun lamps used in older tanning booths can emit doses of UVA rays as much as 12 times stronger than that of the sun. You should use tanning booths that emit UVB rays if you want to produce vitamin D in your body, because vitamin D is what protects you from skin cancer and other diseases. And now something about sunblock lotions. Sunscreens are measured by their sun protective factor, or SPF. SPF indicates how long it takes for UVB rays to redden your skin when using a sunscreen compared to how long it would take if you didn't have the sunscreen. For instance, someone using an SPF of 15 will take 15 times longer to redden their skin than if they didn't use the sunscreen. An SPF 15 will prevent 93% of the sun's UVB rays from reaching your body. The Skin Cancer Foundation maintains that SPFs of 15 or higher are necessary for adequate protection. Well, let's talk about this for a minute. Let's see. If a sunblock of 15 SPF blocks 93% of the UVB rays that can cause sunburn, isn't it also blocking the UVB rays that the skin needs to produce the vitamin D that protects the skin against cancer? Well, of course, it's blocking your ability to make vitamin D. And that's partly why we are the most deficient area of the world for vitamin D. We block its production because we're afraid of skin cancer. And the very thing that would protect us from that cancer is what we're blocking. So let's look a little deeper. UVA rays penetrate the skin deeper, and they get down into the basal cell, the deeper layers of skin. And the damage from those rays is what triggers the initiation of skin cancer. Research shows that UVA exposure is more damaging to the skin in terms of skin cancer than UVB rays. And now, after the damage from UVA rays is done, we go out and get a sunburn. Can irritate and make the skin damage worse by causing a burn on the surface over the area where the deep skin damage is done. UVA rays initiate skin cancer deep in the skin. UVB rays trigger the production of vitamin D that protects us against skin cancer. Sunblock prevents the UVB rays from penetrating our skin. We're blocking the sun that protects us from skin cancer. What's wrong with this picture? Now, in all fairness, there are now sunblocks that do prevent UVA rays from penetrating the skin, but they only just now are coming out on the market, and you have to read the labels. That's the vitamin D story. I want to thank you for listening. So, did you know that cats and dogs lay out in the sun for the same reason we do? They like to soak in the vitamin D rays. They like to get that sunlight, and in their fur they produce vitamin D. And when they come in, then they groom themselves, and we think that they're cleaning themselves up after being out in the weather and in the yard. Well, they are, kind of, but what they're really doing is licking off all of that vitamin D that's produced on their fur by the exposure to sunlight. Well, birds also like being out in the sun, and when they're out, they're sun tanning, if you will, and they're preening themselves, and that's how they get their vitamin D. They're actually licking the vitamin D right off of their feathers, and it's absorbed, and they keep their bones healthy and strong, and the rest of their body functions well. So if your dogs and birds and cats are inside all the time, they're not getting their vitamin D, and you need to let them supplement. And I give our dog 10,000 units of vitamin D every day. We don't have a cat or a bird, but if we did, I'd find a way to supplement for them or get them outside in the sun every day. So then we think about the chickens and the eggs and the farmers. And a lot of farmers have free-range chickens, which means that they're out in the pasture and they're feeding on the grass and the bugs and the grains that they find in the ground. And of course they're out in the sun. And so their bones and their eggs are going to be better developed. They're going to have more calcium because they have more vitamin D to absorb the calcium. So the eggs that we get from this industry that raises chickens for the eggs are not as healthy because they didn't get the vitamin D they need from the sunlight because they never see the light of day. And so that's another reason to seek out a farmer or a source for your good free-range eggs, because those chickens are out in the sun and they produce the vitamin D they need, and their content of their nutrients will be much healthier. And so get good chickens, get good eggs. Farm animals need the sunlight just as we do, and so get your food sources from farmers who allow their cows and pigs and chickens to be out in the sun, to be out where they belong so that they are healthy. Because they're raised in a healthy way, they don't need all the antibiotics and injections that they would otherwise get. So, healthy chickens, healthy cows, healthy pigs, healthy food.